The road to chronic disease, from arthritis to heart disease, is paved with sugar and refined carbohydrates. It's a freeway that leads straight to insulin resistance syndrome, given the right conditions, most notably being overweight and inactive. This devastating chain of events that leads to chronic disease goes like this. Carbs and sugar break down in the digestive tract to glucose that the body uses for energy. Number 2. Then the beta cells in the pancreas make and secrete insulin into the body to ferry any glucose you don't use to muscle, fat, and liver cells for storage. Given the right conditions and more glucose than your cells can manage, the call goes out for even more insulin. Beta cells keep the insulin flowing, but eventually the body's cells can't absorb it or the glucose building up in your blood. That's called insulin resistance. Eventually the beta cells can't keep up and the insulin levels plummet. Now your bloodstream is flooded with glucose, which damages nerves and blood vessels, causes inflammation, and leads to a host of chronic diseases. Here's a short list of what may lay ahead for you if you fail to reverse insulin resistance as soon as possible. Heart disease, high blood pressure, prediabetes, diabetes, or also metabolic syndrome, arthritis, Alzheimer's, which if you've seen my previous post is also known as type 3 diabetes, polycystic ovarian syndrome, also known as POS, obesity, non-alcoholic fatty liver disease, and pancreatitis. So take the first exit. Don't get on that roller coaster. The sooner you give those beta cells a rest, the better your chances of avoiding insulin resistance and diabetes. Don't get on the cycle of insulin resistance. The intervention is simple but not easy if you've spent a lifetime eating processed foods and drinking sweet sodas, like most of the US. So here's what you've got to do. Clear your cupboards and fridge of processed foods and those that contain sugar, even if they seem to be, quote, healthy, like packaged granola, energy bars, and even yogurts with fruit. If it comes in a bag or a box, you should probably just get rid of it. Eat whole, real foods. That is, foods made with ingredients you recognize as foods and without pesticides, additives, or any other ingredients you can't pronounce. If it's over 3 syllables, get rid of it. Count your veggies and fruit. 7 to 10 servings a day is currently recommended. A serving is a half a cup, or for lettuce and leafy greens, a full cup. And this doesn't mean 7 to 9 servings of fruit and 1 serving of veggies. Actually, it's the opposite. But for starting with, half and half is okay. You're also going to want to avoid simple carbs like sugar and white flours and eat complex ones found in high fiber foods. These digest more slowly and don't cause a sugar surge in glucose. Now, I'm not even touching on the subject of wheat or gluten here. That's a subject too big for this little post. Just know that for most people, okay, all people, I'm not a big fan. Regular exercise, particularly high-intensity interval training. See my previous post on how to do HIIT training for the most effective results. This makes muscle more sensitive to insulin. Good thing. Okay, you're also going to want to sleep well, night after night. Sleep deprivation has been shown to promote inflammation, obesity, and adrenal fatigue, hormone issues, and lots of other issues. Sleep is when your body heals itself, so get lots of quality sleep. And for you nighttime shift workers, do the best you can. Of course, it's not always easy as do this or that and things will be hunky-dory. There are a lot of other health issues that can get in the way of doing some of the simple things outlined above. If you need some help, give my office a call. I also do online consultations as well. I'm Dr. Craig Mortensen. Be healthy, be happy. P.S. If you have a burning health question that you think would make a good blog or vlog, please let me know. It's not that I don't have enough topics to talk about, but I'm always up for new ideas.